stepping through this seaside encampment.
Cigarette. You need a cigarette?
Lindsay Veenhuis.
How you doing?
Good, how are you?
All right.
How's it going?
Sees more than most people.
To help kind of connect with people and show them that we care.
She recognizes what those here are going through because she's been in their shoes.
I have slept in those storage units right over there. Yeah.
Lindsay is a recovery ally with Clatsop Behavioral Health Care.
And now I work with the team that helped me get sober.
She connects people on the streets with addiction and housing services.
I was actually a heroin addict, so it was kind of before the fentanyl was around, and I'm very fortunate for that, actually.
Since the start of this year, 19 people have died from an overdose in Clatsop County, 16 of those from fentanyl.
Yeah, so.
Lindsay knew 5 of them.
It's terrifying. It's really scary.
Many others are overdosing and surviving. One woman told us it happens out here a lot.
I just run to wherever somebody's screaming help.
She didn't want to show her face, but tells us she stays at this seaside camp. She tries to help when she thinks someone is overdosing.
The first thing I do is see if they're breathing, which usually they're not.
How often does this happen?
At least weekly. I mean, there's probably somebody dead, probably at least twice a week.
Michael knows what that's like.
Well, being someone that's died like that before and come back, well, I'd say, it's pretty sad, actually.
How many times have you overdosed?
I don't know, 5 or 6.
When you're on fentanyl and you're hooked on that stuff, you really don't care or think about much. You just want to not be sick.
It makes you feel really powerless on how to get a handle on things. So.
Trista Boudon.
Yeah, this is our rapid access clinic. It is open Monday through Friday from 8 to 5.
Works in recovery services at Clatsop Behavioral Health Care.
We're going to all of the camps. We're going all across the county. We're seeing it in the homes, but a lot of people just see it outside the homes. This is not just an unhoused population person issue. The substance use does not discriminate.
What we're looking at right now are different gauge syringes.
At the county level, Nadine Campbell-Davis is part of the harm reduction team.
So this is our harm reduction vehicle. This is mobile.
Each week, they park it in Astoria and Seaside. It's filled with drug supplies and other resources.
So we have tourniquets, we have saline, we have alcohol wipes, we have cottons.
Last year, they gave out 1,100 kits of Narcan. So far this year, 500.
I don't think it's enabling the crisis. I think what it is doing, it is helping our community by destigmatizing.
On average, Nadine says, one person each week will agree to treatment.
It's a tough one. It's hard. I'm with the clients every week. I see them. I hear their stories. I see their faces. I see their pain.
We're really working to give people as many off-ramps as possible before they get to overdose.
And compared to urban areas, those on the coast say it's a tougher fight here.
Resources are more scarce. They're very far apart. We don't have as much infrastructure for transportation.
It's kind of just whatever we tend to bring that day, and people are really grateful for it. So
the drugs know no boundaries.
Clatsop County Sheriff Matt Phillips wishes they could do more to stop the flow of fentanyl into the community.
One of the challenges has been staffing levels. I have commitment from the other 5 chiefs of police in Clatsop County that they would love to staff up a team to focus on drug dealers and crimes related to substance abuse and use. And right now, most of the agencies aren't fully staffed.
Still, they're doing what they can.
With the purchase of this machine, we can run the toxicology the same day if necessary.
The sheriff's office just got this new testing device. It confirms in real time if fentanyl was the cause of a fatal overdose. They're the first county in the state to have such a tool.
One of the challenges with tracking overdose deaths is the length of time it takes to get toxicology results from the state.
As for those non-fatal ODs, like the ones happening in this seaside camp,
we really know about very few of the overdoses because of the proliferation of Narcan in the community. It makes it a challenge to understand the scope of the problem.
A problem that's only getting worse.
You wonder how people could live like this? Well, it's easy if you have fentanyl. You could be comfortable anywhere, and it's just the way it is.
Now, I want to take a moment and pause at what that man just said. If you have fentanyl, you can be comfortable anywhere. Well, I'll be honest, and many of you know, I've talked with a lot of homeless people and a lot of people struggling with addiction, and no one has ever put it quite like that. For so many on our streets, no matter the city, drugs are what's keeping them here. It may not be how they got there, but for many, it makes getting off the streets that much harder. And with fentanyl being what it is, like that one man explained, it allows people to cope with living in a tent, in the cold, in the rain, in the rats, in the dirt, and not to mention the myriad of other dangers that come with street life. And as you just saw, agencies across the county are trying to keep pace with this crisis as best they can with limited resources. But there has been some success. When state law changed this past September, making possession of user amounts of hard drugs a crime again, the governor encouraged all counties to create deflection programs. That's options for treatment over jail for people caught solely with possession. Well, take a look at this graph. It shows the number of people who engaged with the deflection program in Clatsop County since the law changed. The top bar there shows 29 people were offered deflection. The next line shows that 14 people entered the program. Now we're going to jump down a few lines. Just 4 people completed the program, and 5 people tried but failed.
We now have our deflection program here in Clatsop County, and that has done really well. We have multiple people who have graduated the program who are no longer using substances.
We are really capturing people and changing their lives and getting them off of drugs. People that we've always seen as very resistant to changing. And in some cases, this new approach is really being effective.
All right, let's broaden our scope a bit. Despite the rise in Clatsop County, new data from the Centers for Disease Control shows overdose deaths nationally are starting to fall. This graph here shows reported overdose deaths since 2015. They hit a peak between 2022 and 2023, and since then they have started to slide. In January 2024, there were about 105,000 overdose deaths in the U.S. By December, that number was down to 79,000. Now, if we zoom in to the Northwest, Oregon and Washington are seeing overdose deaths fall as well. From December of 2023 to December of 2024, Oregon saw 22% fewer overdose deaths, and Washington saw 11% fewer. So, what is behind the drop? And more importantly, can we keep it going? The Oregon Health Authority says there are things that are working.
Changes in the drug supply, so the availability or the potency of the fentanyl that's out there on the streets, that could be going down. We have some indications of that, although it's a bit hard to measure. And I think on the other side, when it comes to the resources that we have to reduce drug use, harm reduction resources, treatment and recovery services, we've worked really hard in Oregon, and we've been increasing the funding for those services in recent years. And I think we're starting to see an effect there as well.
And of course, when talking about drug overdoses, there's one tool that we hear about a lot. That's having a major impact.
One of the big things, I didn't really mention it, but one of the big things among our efforts has been naloxone. And naloxone is the kind of opioid reversal drug. And so we've really worked hard to increase our infrastructure to expand access to free naloxone and education about how to use it. So people who are out there in schools, on the streets, just people anywhere can actually have access to that life-saving drug.
Now, despite lower overdose deaths, it is still the leading cause of death nationwide for people ages 18 to 44. And Dr. Jean says rural areas like Clatsop County face bigger challenges.
Everything from the economy and the availability of jobs, the availability of services, whether it's healthcare or treatment and recovery services for drug use. Those are all sometimes harder to find in many rural areas. We've been working across the state with community-based organizations to try to bolster that, but there remain some significant disparities, certainly in the rural areas.
If you or someone you know wants to try and get help, OHA has a 24/7 support line, and you can call it. That number is 1-800-923-4357 for help finding resources.